The American Heart Association has developed a simple tool so that you know where you stand on your road to good health. And here to talk to us is Andrew Gaffney, a physician's assistant with a specialty in cardiology and a certified athletic trainer. Thank you, Andrew, for coming by this morning and chatting with us.
My pleasure, thank you.
All right, so there is something out there called Life's Simple 7, right?
Right.
All right, let's talk about this. What is Life's Simple 7?
So the American Heart Association came up with 7 known risk factors that are well established in the literature to lower one's chance of developing cardiovascular disease, which, as many know, it is still the #1 cause of mortality for both men and women. That's in the United States and worldwide.
More than cancer, right?
Correct.
Okay.
In fact, 2,150 people, Americans, die every day from cardiovascular disease. That's a person every 39 seconds.
Wow.
So,
my goodness. Okay, so we're taking a look. These are Life's Simple 7s. This is what we need to know?
correct. It really boils down to these are modifiable risk factors that we know improve one's quality of life and extends their survivability. It really boils down to, yes, controlling your blood pressure, controlling your cholesterol, diabetes management, stop smoking,
Manage your weight.
obesity, having a healthy diet, and of course, regular physical activity.
You know, it's so important. Obviously, eating well is important. That's a big one of the factors. Not always easy to do. What do you tell patients or clients?
It's a big topic. Briefly, I would say you have to increase your daily intake of both fruits and vegetables, as well as fiber and omega-3 fatty acids.
Okay.
Try to avoid
heard
foods
that.
with a high glycemic index. That means how quickly your blood glucose level rises after you eat that particular food. Lastly, try and avoid or consume more monounsaturated fats as opposed to trans fats or saturated fats.
Yeah.
If I'm pinned down by my patients and they ask me a specific diet, I would more often refer them to the Mediterranean diet.
Really? Which one is that? I've heard of it.
Well, that is basically healthy fats.
Certain foods to stay away from, obviously.
Absolutely. It paints a pretty clear picture of what a healthy diet should be. And it is, in my knowledge, it's one of the few known diets out there, fads, if you will, that really does have proven efficacy in lowering one's chance of cardiovascular disease.
Mediterranean diet. I got to remember that. What about the paleo diet? Can I ask you about that? Because that one is gaining a lot of popularity.
That one I don't know quite as much about,
Yeah.
and for
It's like raw, like very natural foods. I guess just the bottom line, though, stay away from those bad fats.
certainly speak to your healthcare provider about
Yeah.
which diet fits your lifestyle best and what can most benefit you.
You know, what if you're out there and you have no idea whether you might be at risk of, would you say the first step is to just go see a physician, go to your general doctor and have them do an exam?
Well, absolutely, yeah. One thing I learned early in my career is that you don't have to have all the answers, but you should know where to find all the answers.
Sure.
For that, a lot of resources available, including the American Heart Association's website.
Sure, sure.
But more specifically, I would say you need to establish with a primary care provider who can help you lower your risk for cardiovascular disease, diabetes, and so forth. And of course, ABQ Health Partners is right in line with this Life's Simple 7s as far as the total care model.
Sure.
Preventative medicine,
It's just so important.
patient-centered healthcare.
And we can't, hopefully this information has empowered you at home, at least to give you, a start, a guide to, okay, these are the things I need to look out for. Let me contact my, my primary physician. Start there and then see where it goes. Thank you, Andrew, for coming in,
My pleasure.
chatting with us. For more information, we do have a link for ABQ Health Partners and the American Heart Association on a website. Just go to CASA.com and click on the CASA blog.